so I'm the scientist who was referred earlier by the earlier presenter. So I'm not sure why I'm in this section of communication, but I'll try my best to represent my fellow scientists. And will you promise me that if I get it right, I'm going to get an award next year for science communicator? Yeah, so I'm just here to share with you some study we did. So in South Africa, we actually have advanced in use of one of the technologies, genetically modified mosquito technology as a vector control. So we have actually done some field trials. And as part of those field trials, we're also trying to do community engagement. So we had a number of strategies that we used to do community engagement. So I'm just here to try and, because now we are evaluating, because we are now moving on to a bigger project where we're going to do releases on a wider scale. So we needed to evaluate our community engagement strategy that we used. So I'm evaluating one of those strategies that we used. And so actually, when we were looking at ways we can engage the community, because we're working in a rural community, we actually were looking at what is the best strategy we can use for this particular community. And we realized that use of creative arts to communicate our complex strategy and to gain acceptance from the community, we need to be a bit creative. So that's why we opted for use of arts. So that's what I'm trying to unpack here. I think it's not working. You can move to the next slide. Yeah, so I've got a very brief background because I think I've presented in a number of forums about the malaria situation in South Africa. So where we are now is that we have made a huge stride in trying to reduce the burden of malaria to the extent that we are now looking at malaria elimination. So over the past 10 or so years, we have been doing the same thing over and over again, and we're not managing to reduce our malaria cases. So we started now thinking that maybe it's high time we should use alternative vector control strategies so that we can try to supplement the current strategies and try to reduce the burden further, leading to elimination. So out of the genetic-based methods of biocontrol, we chose the SIT due to a number of reasons. But the challenge we face now is that this technology is based on releasing mosquitoes, and we are claiming that we want to control mosquitoes. At the same time, we are releasing millions of them into the environment. So it raised a lot of suspicion from the community, and we saw that if we don't do it, communication properly, is going to compromise our implementation strategy. So one thing we knew straight from the beginning is that for any acceptance of any public health intervention, you need to engage the community. Otherwise, if you don't do that, we are not going to win. And actually, we had learned from literature that success of a similar trial in Brazil was mainly to do with a robust community engagement strategy. Then we also had some examples where it didn't go so well because of misinformation and also lack of proper communication. So at least we had a base to start from that. We knew that community engagement has to be done to break that barrier. So the first thing we did is we are going to a community, we don't even know anything about this community. So what we wanted to do is, first of all, to understand what are the community needs and how best can we approach this community so that we can introduce this technology. So in order for us to do that, we did a CAP survey where we really tried to understand what does the community know, what are their fears, what are their concerns if we are to come up with another another public health intervention, which is also a bit suspicious because you are releasing mosquitoes to control mosquitoes. So during this CAP survey, this is when we learned that they don't have, though they have knowledge on malaria, They don't have knowledge on alternative vector control strategies, and they didn't even know that there are some new technologies under the pipeline which is being developed. So that was the basis for us now to start discussing with them on how best we can start engaging with them so that we can provide the information. So the first thing we did was to make sure that we really understand how best can we penetrate this community. So we had to identify what is the most preferred method in which we can engage this community. So we had a dialogue with a number of stakeholders, including the community itself, the community leaders. We also had people who were working on our project, also trying to unpack the technical aspects. We engaged the local radio stations so that they can also assist us if they can assist with the communication. We worked with the National Malaria Control Program. We also worked with the various research teams. So during these dialogues, we ended up identifying creative arts as one of the two we can use for this particular community. And three forms actually came out highly, which was the use of music and the use of radio stories and engaging schools through school dramas. So after identifying that these three arts are the most critical ones, we had to start thinking on how best we can do this. So what we did is we worked with the community to develop the best information we are going to use. So we developed a pamphlet. After developing this pamphlet, we started engaging the specific stakeholders who are going to help us to develop this. So we identified, for the music, we identified a popular local artist who is known in that area and plays a specific genre which is specific to that community. So that genre is called Maskandi. It's very popular in that community. Then we also knew that from the engagement with community radio stations in that area, they said normally when they are doing their health promotions or promoting anything, they use short stories which are played on radio every week. So we also gave them the pamphlet and asked them to develop short stories that can be aired on community radio stations so that we can use that platform to engage the community. Then we also engaged schools, both primary and secondary. We asked them to develop a drama for us, which is based on the pamphlet we had distributed. And we eventually ran a competition so that we choose the best school which has developed the best drama, the drama which is going to be played in different public events. So after doing that, identifying, and the community helped us in developing the three different art forms, it was time for us to pilot, now to go to the community and start engaging. I think I had a copy of the music on the left, but I'm not sure whether we've got time to play that. So the music which was developed and played during different cultural events and during World Malaria Day. Then for the drama, we actually ran a competition through schools, and the chief was always there for us to give the best performing school. And we also played short stories where we are also using the prime time, and we ran about 14 episodes on the community radio station during prime time. So what I'm doing here is I'm not going to detail on how this worked out, but what we did is, because we are now moving to the next step, we needed to measure if what we have done before intervention and after intervention and our pilot trial versus what we had seen in the CAP survey, did our community strategy work or not, so that we can refine it as we go further. So what we did is we did a cross-sectional survey where we went into the community. So the study population, actually we used a two-stage sampling where we gave numbers to all the households in that particular community. Then we randomized using Excel to get the numbers which were chosen. Then when we went to the household stage, we did a quiche grid where we ended up selecting the participant who should participate in our interviews, and it has to be an adult who had resided in that area for more than 5 years. And during data collection, we were administering a questionnaire which we had developed, and this was done through RedCap. And we then analyzed our data, and actually we were looking at 4 main attributes: demographics, then we were also looking at knowledge, attitude, and then acceptance, and this was divided into different scores, and scores were based on the number of questions for each area we were looking at. Then we used descriptive statistics and also logistic regression to see if there's any associations. So just briefly to go on what we discovered. So I just highlighted what was more important when we came now to deeper analysis. So we showed 60% of the community actually had completed secondary education, and 66% of the community was not unemployed. So this gave us in future when we want to engage, how do we come up with our strategies? Then what was more important is that 80% of the households are exposed to different communication channels, including radio, telephone, and television. So this is also will guide us in future when we are doing our engagement. Then 32% of the population had history of malaria exposure, which was expected as it is an endemic area. Then what was a bit disappointing is that after our efforts, we saw that only 31% of our population were exposed to the information we were trying to distribute. But however, we saw that there is a spillover effect because these 31% ended up talking to the others. So this is direct exposure. Then among those who were exposed, we saw that 93% had actually been exposed to our engagement strategy. At least 2 of the methods we had done of the 3. And 93% were actually exposed through the songs. Then 16% were exposed using short stories, and 58% were exposed through dramas. So when we are now going deeper into the analysis, we saw that based on the previous baseline we had during CAP survey, there was an 85% increase in knowledge on the SIT program and malaria in general. Then in terms of attitude, we saw that when we started, people were very skeptical about the technology. But after we have done our community engagement, 91% had positive attitude. Then what was quite interesting was the acceptance. So when we actually did the releases now, 97% of the population were accepted our technology, and we didn't face any resistance when we were doing the actual intervention. So this is the association now, the relationship that we found, so that when we were developing our strategies. So we saw that knowledge was highly significant and associated with exposure. So those who were exposed, their knowledge was high compared to those who were not exposed. Then if we looked at attitude again, those who were exposed had a better attitude compared to those who were not exposed. Then when we but what was also a bit strange with these results is that acceptability was not determined by the exposure we had done, but we really understand because we also had other different communication strategy we're using. Then when we stratified by art, we saw that those who were exposed to songs were highly knowledgeable compared to those who were exposed to short stories and drama. The same applies to attitude. Those who were exposed to songs had better attitude than those who were not exposed to those who were exposed to short stories, drama, or not exposed at all. And there was no difference in terms of short stories and drama. And the same applies to acceptability. In terms of short stories and drama, even to songs, there was no difference, but we know how to explain this. Then the level of exposure, again, didn't any significant difference in terms of knowledge, attitude, and acceptability. So which means maybe one communication strategy might work for this community. Then we went deeper now to understand for each level. So what we found out was quite interesting, that in terms of education and association with good knowledge, we saw that at those who were done primary level or secondary level, the odds of them having good knowledge or acquiring good knowledge was twice as high. And we also looked at unemployment, which was a bit interesting. We saw that those who were actually unemployed, that 3 times their odds of good knowledge or understanding SIT was 3 times higher than those who are employed. So this could be explained by that the strategies we're using, we're doing during the day, and most people will have gone for work, so they were not exposed. Then in terms of exposure, those who were exposed at least to one art, their odds of getting good knowledge on SIT was 4 times as high as those who were not. And like I said before, there was no significant difference in attitude, acceptance of SIT, which we observe. Then age, gender, and family history was not associated with good knowledge. So what does this mean for us in terms of going forward in terms of our communication engagement? So we have actually seen and demonstrated that for this particular community, if we use art-based communication approaches, we are more likely going to increase knowledge and acceptability. So this actually gave us an idea that use of arts is culturally relevant, and it's a very good engagement too if you are dealing with a community which is rural. And we also saw that our initial engagement actually helped us in improving acceptability of the new technology. And there were also other factors which are involved, which resulted in very high acceptance level. So this was mainly trust in the intervention and the perceived effectiveness that it plays in overall acceptance. So on reflection, because we also have to give back feedback to the government and to the National Malaria Control Program, what does this really mean? So we are now encouraging our malaria control program or our public health personnel that they should try by all means, if possible, to incorporate cultural elements during the malaria awareness campaigns. Then, based on the approach we took, anyone working in gene drives or any new public health intervention, it is actually important for you to prioritize community engagement early, and this has to be continuous if you want to improve uptake of your new technology. And we also recommend to funders that they should also consider when they are funding to agree on a budget for community engagement. So basically, to sum it up all, is that when implementing novel vector control strategy, it is essential to use communication engagement strategies that are community-driven and are relevant to that particular community. So this is where my story ends, and I'll take the questions later on.